Hi, welcome to everyone who just joined. We're going to take a couple more minutes and then we will begin.
Awesome, thank you.
Hi, Esperanza. I think we are ready to get started.
All right.
Thank you.
So welcome. Okay, so welcome and thank you for joining the Asthma Medications webinar. Today, my name is Melissa Pantoja from Esperanza Community Housing Corporation in South Los Angeles, and I will be moderating today's webinar. Before we begin, I would like to start off with some webinar logistics. Everyone on the webinar will be muted. If you have a comment or question during the presentation, please use the chat box to send a chat to all participants. The presenters may miss a comment if it's a direct message. The webinar will be recorded so you can watch it again in the future if you wish. The link will be included at the end of the webinar. At the end of each webinar, there will be an evaluation that will open in a separate window. Please take a minute to fill out the survey to help us make each webinar better. Thank you in advance. So the 6-part webinar series was developed from the Asthma Management Academy, a professional development opportunity created in 2016 by the California Department of Public Health, Esperanza Community Housing Corporations, and Comité Cívico del Valle. The Management Academy was developed for community health workers and health educators to support them in educating their asthma clients on self-management. This is the 4th webinar series of the 6-part series. We will host one-hour webinars once a month. Our webinar topics were chosen and prioritized by the Asthma Management Academy participants and include pulmonary function testing, reproductive health in asthma, and healthy homes, among other topics. Each month, we will hear from a clinical and a community subject matter expert. These presenters will have time for questions and answers at the end of the presentation. Our topic today is asthma medication. We will be hearing from clinical and community subject matter experts. They will discuss the differences in controller and quick reliever medications, review new medications and delivery devices, share how educators can support their patients or clients in medication use, and discuss how educators can support clients in overcoming barriers. The clinical subject matter expert is Traci Harden, MPH and Certified Asthma Educator. She has her master's in a public health degree in health promotion and education from the University of South Carolina and is a certified asthma educator. She has been educating parents, caregivers, and professionals since 1997 on appropriate asthma management while working with both the managed care and nonprofit sector. Traci created her own business, Breathe Well SC LLC, to continue her efforts of promoting best practice in asthma management to providers, caregivers, and those with asthma. She has been actively involved in South Carolina State Asthma Coalition, the SC Asthma Alliance, and is a past board vice president of the Association of Asthma Educators. Traci has been a reviewer for the Journal of Asthma and Allergy, has published an article for Advance for respiratory and sleep medicine, and has facilitated asthma trainings on the local, state, and national level. The community subject matter experts are Carmen Hernandez and Vanessa Frances Navarro, are both from Inland Empire Health Plan. Inland Empire Health Plan, or IEHP, is the largest not-for-profit medical and Medicare health plan in the Inland Empire and one of the fastest-growing health plans in the nation. Their mission is to organize and improve the delivery of quality, accessible, and wellness-based care services for our community. Carmen Hernandez graduated from Cal State Fullerton with a degree in child development with an emphasis in adolescent studies. She has worked as a manager for the Health Navigator team in IEHP for the last 5 years, with previous experience working in the mental health field. Her current team is comprised of community health workers that work with IEHP members in their home or where members feel most comfortable. The Health Navigator program aims to increase preventative care and reduce emergency room visits and hospitalizations. The program serves as a link among members, providers, and IEHP, ultimately leading to better communication and care. As a program, they strive to provide a link IEHP members to various communities-based organizations that can help them with any social determinant needs they have. Vanessa Navarro has completed coursework toward a communications degree from Cal State Long Beach. For the past 6 years, she has developed and established collaborative relationships in the healthcare field, multicultural communities, and has extensive knowledge of a medical managed care environment. She has been certified in the eligibility technician induction training program for the Medi-Cal program for the County of Riverside and determines medical eligibility in accordance with established procedures. She has worked as a community health worker for the Health Navigator program, conducting health appraisals for members and non-members alike in an effort to connect the community to various community-based organizations, provide relevant resources, and assist in any social determinant needs.
Ashley, we may need some help advancing the slide here.
Okay, so please check out the Asthma Management Academy Facebook page and like it. Thank you. So next slide. So now we will begin with Traci Harden, MPH, and Certified Asthma Educator. Thank you, Traci.
All right, thank you so much for having me do this webinar. I'm really excited. Community health workers are near and dear to my heart, and any opportunity I can have to help out is greatly appreciated. And just want to say hey to everybody from South Carolina. I'm way over here in the south where it's 100 degrees right now, so you guys are probably enjoying much cooler weather. But greetings from South Carolina. So what I want to do today I'm assuming that most of the folks, if not everybody that is listening in today has gone through your Asthma 101 Academy. And what I want to do is just give you a good overview, again, of what it means to have asthma and what that means in terms of the medications that you need to have. So with that, I'll go ahead and get started. What I do want to just mention is that I am representing the Association of Asthma Educators today. That's my main hat because we were fortunate enough to partner with the California Department of Health, and they adopted our community health worker asthma training curriculum that I had the wonderful opportunity to help create. And just so if you're not familiar with the Association of Asthma Educators, it is a group, a national group that is available to anybody that teaches asthma. You do not have to be a certified asthma educator to be a part of this group. And I encourage you to go to the website, just Google Association of Asthma Educators, and find out more about us, because we're all about just supporting those of you that are out there in the trenches, trying to promote excellence in asthma management. Okay, so let's begin. If you remember in the trainings, we go back to the beginning that there's always, to remember there's two parts to asthma, and those two main parts are the mucus and the swelling going on inside the airways, and that squeeze of the muscles constricting around the airways. It's very important when you're talking to your clients, your families, whatever, your patients, that you explain those two parts, because when you get into the asthma medications, remember the medications work at the different sites, and it helps kind of take the why out of why do I need to be taking all this different kind of medication. So remember, we have long-term controller medications, and then we have quick reliever medications. Those are our two main groups of asthma medications to treat the different types of asthma, whether it's mild, moderate, or severe. And I want to stop and tell you, you're catching me at a really great time, because I just came back from our national Asthma Association of Asthma Educators conference that we have annually. Again, another plug for them. It's a great conference that you should look into going to. They have it once a year, and it travels. Next year it's going to be in Minneapolis. But one thing that I learned, that the national, well, actually the international guidelines, the GINA guidelines for asthma, treating asthma, came out with, is now even mild asthma, they're suggesting that people be on both a long-term controller medication and a quick reliever medication. It was just have that albuterol available or that quick reliever, but now they're saying that to avoid severe asthma coming on, you're going to start seeing, as you're working with families, more and more people not just being prescribed a quick reliever, but also that long-term controller. So back to, there's two parts to asthma. So remember, the long-term controller medications just work in the inside of the airways to reduce that swelling and mucus. Some people have called that works to deal with the silent part of asthma, the part of asthma that you don't necessarily feel going on, but is the deadly part, that if it's not treated can cause, you to not be able to get your asthma under control. So the long-term controller medications, remember, reduce the swelling and the mucus. Now, it takes this is probably just a review for most of you guys that took the Asthma 101. Remember, it takes a little bit of time for the long-term controller medications to have full effect. So you have to encourage people to give them some time before they start noticing changes in how they feel. So it takes about 4 to 6 weeks, and you don't feel them working necessarily, so you've got to encourage people to take it every day no matter what. I had one physician put it, he said he tells his patients to take your long-term controller medicine every day, amen, 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 no matter what. So it's really important that they stick with it and give it a chance, because this is the medication that is going to make the big difference in their daily asthma control. Now, to talk just a little bit, and this is kind of adding on from the 101 discussions. So you have the long-term controller medications involve your inhaled corticosteroids or your inhaled steroids. Then you've got those groups of medications that are combination medications, and don't get thrown by ICS plus LABA. I just wanted to throw out some technical terms for you, so at least you know, if you come across it, you'll say, hey, I remember seeing that before. ICS just means inhaled steroid, and LABA means long-acting bronchodilator or a long-acting albuterol. So these are the combination medicine like the Advair that you see out in the marketplace, Symbicort, another one is Dulera. So those are the combination medicines that you see a lot of people on that have made a huge difference in the lives of a lot of people in terms of their asthma control. Then you have the leukotriene modifiers. That is your Singulair. You guys definitely, I'm sure, are familiar with Singulair. That's the pill. And that is one that is used, not to confuse things, but it can also be used just for allergies. You might have people you know of that are on it that don't have a diagnosis of asthma because they found out that it also does a great job with controlling allergies in a lot of patients. But it is an asthma medication. And then I did want to mention this really long word, immunomodulators. For those of you out there that like to watch TV like I do, and you see all these commercials for medications, you're starting to now see the commercials for these biologic drugs. They're injections, they're shots for asthma. One example, I think one that's done a lot, at least here in the South, I see on TV a lot, is Fasenra, is the shot that you'll see the commercial talking about it. Basically, what I want you to understand at this point, and then do your research, is that the biologics are for the severe asthmatic. They're the ones that are on high doses of inhaled steroids. They may be on oral steroids as well already, and they're still having problems. And that's when the physicians are starting to look at introducing these biologics. So I wanted to mention that so you knew that it was out there. So I'm hearing that you might be having a hard time hearing me. I'll make sure that I'm a little bit closer here to I'm not using a phone. I'm actually using the computer. I'm getting messages. I'm going to get rid of, let's see if that helps. You guys let me know if that helps and you can hear me a little better now. The immunomodulators, again, are just biologics that are added for severe asthma. Okay, I'm hearing that you can hear, that you can hear me better now. Sorry about that, guys. Technology. So moving on. So that's basically the gist for long-acting medications. So remember then the quick reliever medications relax the muscles or relieve the squeeze. That's always an easy way to remember that. Or they're relieving the constriction of the muscles around the airways. So they're there to treat the symptoms. And as we all know, it's the quick reliever medicines are to be used as needed. They are not something to be used daily unless, there's always an unless, isn't there? They're being prescribed for exercise-induced asthma. And then you might see a prescription where it says to take a couple puffs of your albuterol 15 to 20 minutes prior to exercise. That's the only time that you want to be taking your quick relief medication on a consistent basis and knowing that everything's okay. If you're taking it on a consistent basis, you know the deal is through rules of two that where there's something going wrong and your asthma is probably not under control. Remember, it does work fast, but it only lasts about 4 to 6 hours. Okay, so just again, a little bit of terminology that I want to throw out there at you just so you know that you've seen it before. The quick reliever medicines are called bronchodilators or short-acting beta-2 agonists. You might even see the abbreviation of SABA, but that's all that means. And here we're talking about the four major quick relievers: the ProAir, the Prevental, Ventolin, and Xopanex. Are your four name brand quick reliever medications that are out on the market. And we're going to talk a little bit more about ProAir in just a second. Okay, so let's spend just a minute reviewing. There's the basic common trend in asthma is overuse of quick reliever medications or underuse of long-term controller medications. People are sucking on that albuterol inhaler like there's no tomorrow, hoping that that's going to give them relief, when if they would just use their long-term controller medicine, that inhaled steroid, every day like they're been prescribed, in most cases their asthma would get under great control and they would hardly ever have to use that quick reliever medicine. So I mentioned a minute ago, for those of you that remember rules of two, this is a fantastic piece or tool to use when working with folks that have asthma to get them really thinking, oh, wow, my asthma may not be under control and I need to do something about it. So remember rules of two: have your asthma symptoms, or you're having asthma symptoms, or take your quick relief, your albuterol, more than 2 times a week. And remember, there's an or between that. Or you awaken at night with asthma symptoms more than 2 times a month, as little as 2 times a month with asthma symptoms. Or you refill that albuterol or quick relief inhaler more than 2 times in a year. Your asthma may not be under good control. That's an eye-opener for most folks and can help you as a tool to get those clients, those patients, thinking about what do I need to change to do a better job with my asthma. So let's talk just a minute about the underuse of long-term controllers, and we talked about this in the training. So barriers, and this is where community health workers, and we'll be talking some more about this later in the webinar, where you can have such an incredible impact on reaching folks by identifying these barriers and helping them work through them. So the fear of steroid is a big one. And I hope that you feel a little more comfortable talking about that with your families or your patients that you're working with, that there's a huge difference. Well, first of all, there's a difference between the kind of steroid we're talking about that is used with asthma versus what like weightlifters use. It's anabolic steroids is what sports people, weightlifters, those kinds of folks use, versus catabolic steroids is what's used for asthma. So there's a huge difference in that. But take it one step further. There's a big difference in using inhaled corticosteroids the inhaled steroids versus having to take it by pill or liquid, and what it can do long term to the body. That the inhaled steroid is a much smaller amount, and think about how it is delivered. It's delivered straight to the lungs versus having to go through the body to get where it needs to go when it's given by liquid or by pill or by shot. So remembering to explain it that way to help, families or patients understand that they're getting a very small amount of steroid and it is very safe, relatively speaking, as an inhaled form than any other form that they may end up having to take because their asthma is out of control. But then you're also looking at cost. The cost issue is huge. I know it is in South Carolina. I know it's got to be in California. Do they have insurance? What are the community programs out there that can help if they don't have insurance, sliding scale fees, those sorts of things, just getting them connected to the right resources. And then transportation, can they even get to their medication? So just keeping those kinds of things in the back of your mind to talk to them about that. All right, so let's do a little update here. And another reason I'm glad I went to my national conference because I learned about some new delivery devices that I didn't even know that were out yet. So with the meter dose inhalers, I can't talk about them without reminding you how important it is to encourage everybody that uses a meter dose inhaler to use a spacer or chamber. And looking at the picture on there, remembering that you get way better deposition or amount of medicine deep down into the lungs when you're using that inhaler with the chamber versus without a chamber or spacer. It helps create that space to allow those smaller particles to get deep down in there. So really exciting stuff coming out on the market. This is the ProAir DigiHaler, and it is going to be, it has just been FDA approved, and it will not be really out on the market until next year, but it is the first DigiHaler with built-in sensors. It is going to, so it looks like the ProAir, the normal one that came at the RespiClick, but it's connected to an app on your phone that you can download, and it's going to be able to detect how much you're able to breathe in, how fast and hard, which is really important with dry with dry powder inhalers, to know that it's called inspiratory flow, so how much air you can breathe in and at what rate. And it's also going to be able to track when you take your inhaler so you can see, oh my gosh, I'm taking this way too much, potentially, and you can and also share that with the doctor if you want to. So that's a really exciting new technology that's coming out real soon. So be on the lookout for more information on that. So let's talk a minute about what's new with dry powder inhalers. And I say what's new. These have been out. The Ellipta, some of you may have seen, but we just didn't cover it in the Asthma 101 because it was mainly just the medication in the Ellipta was just used for COPD patients. But now the Brio Ellipta, Brio's the medication name, is now indicated for use in asthma. So I just wanted you guys to see it. I only have a couple minutes left. So what I'm going to encourage you to do is to go. I'm going to have a couple of websites at the end of my presentation that you can go to watch the videos on how to use these different delivery devices. But a real easy way too is just Google the name of the delivery device, go to the actual page for that device that the pharmaceutical companies put up, and they always put a video or step-by-step on how to use the medication. But this one's really easy. If you remember how to use the discus, it's very similar to that. You just pop open the top. That gets the medicine ready to go. You breathe out, and then you hold it like a hamburger. I don't know if you guys talked about that. We always talk about holding it like a hamburger, taking that forceful deep breath in, and then holding your breath for 10 seconds. It's really easy. And then another exciting new thing that's out now is Advair, praise goodness, is now in a generic form. It's called Wixela, and they, of course, with a new drug, they have to make a new delivery device that we all have to learn. But we're calling this in-hub, whereas the Advair discus we call it the hamburger, we're calling this one the pork chop. Because it's sort of, if you can see, looks like the shape of a pork chop, and it's very similar to using the discus again, except this time you're holding it up and down instead of sideways. Very simple. You're opening up the cover, you're pressing down the little lever till it clicks, you breathe out, and then you exhale, and then you put the medicine in your mouth, take the deep, forceful breath, and then close it. And then always, I'll say this with all these medicines, you want to make sure that you rinse and spit at the end. But this is exciting that we finally are getting some generics out there on the market. Still expensive, but less expensive than the brand name. And then just a couple more. This one, the breath-actuated inhaler, QVAR, which is another inhaled steroid out on the market, is now going from a meter-dose inhaler to a breath-actuated inhaler. And I'll show you here. Just for you guys that are going to download, or if you could download this, I did do how to assemble it and get it ready. But basically, without going into all these steps, the ReadyHaler is a soft mist. It's not soft mist, it's a solution in the delivery device. So it's a little bit like a meter dose inhaler, but instead of you having to press down the canister and breathe in at the same time, which is very difficult, with the ReadyHaler, you actually actuate the medicine, cause the medicine to come out by breathing in. So you don't need a chamber or spacer with this, which is really nice. So it's one less thing to fight with folks to use or get covered, because they're expensive too. But it's a really nice, as an asthma educator, I get a little excited about this one because, like the RespiClick, it's real easy to use. So this last one is the newest group. So we have meter dose inhalers, we have dry powder inhaler. Well, now we have what's out, it's called a soft mist inhaler. And I just feel like, I don't know if you guys are getting a little overwhelmed, but there's just so much out there. It's crazy to keep up with, but we'll talk in a second about how to do that. So with the soft mist inhaler, it's called the Respimat. And Spiriva is the medication that's in it. And it, again, is been identified to be used in COPD patients, but now it's also being used with asthma. So I did want to bring that up, and I'm not going to go into all the steps because I know I'm running out of time now, and we can talk if there's more questions at the end. But it's a very simple medication to use once you actually put it together, and there's steps to put it together and to prime it. And then after that, it's very, very simple. you're basically, let me go to the very end here. You're just turning the bottom, click, opening the cap, and then putting in your mouth and pressing the little button, and you take a soft, deep, or a slow, deep breath in. So it's a very simple device to use. It just takes a few steps to put it together. So I'm going to end with putting up a couple of different websites. The Quad AI organization, they have their website has a great spreadsheet of all the medications that are out there and links to go directly to their website. The useinhalers.com has got great videos on step-by-step how to use these. Allergy and Asthma Network, I encourage all of you to go take a look at their organization website, and they're the ones that have the handouts that have all the different medications on them, and each of you got one in your workbook when you did Asthma 101, and it is updated every year, so I encourage you to go on their website. They usually, you have to pay $3, but see if your organization will get them each year for you, because they just, it's medications at a glance, and it's got everything you need to know about the medications, and it can really help you when you're working with your patients. And then National Jewish has a great setup on their website to show how to use the different inhalers and medications. So with that said, I am finished, and I appreciate everybody's time to letting me give you a little update today.
Okay, great. Thank you, Traci, for sharing your expertise and experience with us. So if you have any questions, please remember you have the Q&A available to you, and we will go over these questions at the end. Thank you. So now I'm going to switch it over to Carmen and Vanessa.
Hi, everybody. Thank you for having us. Okay, well, like I said, or like it was mentioned, my name is Carmen Hernandez, and I have Vanessa Navarro, the community health worker, with me.
Hi, good morning.
And what we're going to do is we're just going to give you a little overview of what we have seen in the homes as we're helping educate our families with their asthma medication, and, of course, talk about barriers. We're going to take a bulk of our time talking about barriers and how we've overcome those barriers with our members that we work with. But again, we're the Health Navigator program here at IEHP. I'm going to go quickly over these next 2-3 slides because the information was already mentioned. But as stated, we are a managed health plan here in the Inland Empire, servicing both San Bernardino County and Riverside County. We do have 1.2 million members, a little over 6,000 providers, and we do have over 2,000 employees with IEHP. Now, of those employees, I have 9 health navigators, which essentially is I have 9 community health workers. And of those 9 community health workers, every single one of them has been trained extensively in asthma education. And when I say extensively, it's been basic asthma education. Actually, we went through a training with Traci herself and the Esperanza team. And we've definitely been in the homes and been able to educate on triggers, asthma action plan, and when we've gotten to the point where medication became a major concern that we were seeing in the home in regards to families being fundamentally confused on their medication. That's when we started thinking outside of the box, and we had to be very innovative on our approach with working with our families. I'm going to talk a little bit about that approach in a little bit, but as a program in itself, we do have specific goals. And a lot of the times, aside from working with our families with providing them asthma education, we have to be realistic. Our families are not going to really take in the education that we're there to provide if there's a lot of other needs in the homes that need to be addressed first. So we are working diligently in ensuring that we can meet social determinant needs aside from just reaching our goals in home, which again, one of them being making sure they're connecting back with their PCP and linking them to various community-based organizations that can help them meet those needs. What you see here on this slide, because we're a health plan and we have the luxury of having in-house data for all of our 1.2 million members, I wanted to share this information just so that you all can see exactly some of the data that we have. Our medication management for people with asthma here for IHP, as you can see with the different age ranges, you have the last 3 years, the year and the rate. And we noticed as a health plan how important this chronic disease was in regards to making sure our families are being educated. And the health plan really took pride in having community health workers internally, and really being able to say, what can our community health workers do more of, because we are in the trenches, out in the field, and in the homes with our members. And essentially what it came about was we need to be able to not only provide asthma education in the home, basic asthma education, but also, again, this is where that innovation came in, is how do we better collaborate with other departments internally so that our families can be heard and we can overcome the barriers that they're facing. As Traci had mentioned, which we're going to talk a little bit more, and I'm going to let Vanessa share some stories, is transportation was one of the biggest barriers. Our families didn't have transportation to go see their PCP or didn't have transportation to go to the asthma classes that our health plan was providing at various locations within the counties. So as you can see here, as we noticed with the years and the rates, though the rates fundamentally established itself at a core, we are like 60% at the last year, we were really looking to increase these rates as much as possible. So of course, this is where the expansion came in of asthma. So we do have internally, because as I stated, we are fortunate to be a health plan, we are able to visit our members who have, because we're a non-clinical team, we don't visit members who have COPD, but we do visit members who are who are just recently diagnosed with asthma or are right on the cusp of being diagnosed. We really want to be as preventative as possible. So essentially, we receive an enormous amount of data internally for those members, and then my community health workers go out into the field, and now they visit them in the home and they begin their education. Now, when their education begins, it's really talking about making sure and assessing the family. We are assessing in the home for, do they even know what asthma is? And if they don't, we're there to help them provide that education. We're looking at, do they understand what the triggers are? If not, we're providing that education. Do they understand what an asthma action plan is? And then how to connect back to their PCP. And in our home visits, when we're doing this, please keep in mind that one of the things that we come across is, again, the confusion that our families have. Oh, well, I was diagnosed, my son was at a soccer game and he couldn't breathe, so I took him to the emergency room and he was given an inhaler, so now he has asthma. So we hear those stories a lot, and being, again, that we're the health plan, we do look on the back end to see where was this child diagnosed. Were they diagnosed at the PCP? Were they diagnosed at the ER? And in having that beautiful information, we are able to go in and now educate on that. So if the child was diagnosed at the ER, we now can help them and incorporate them to go back to their PCP and visit, and really get what we call a true diagnosis. Because as we know, when you go into the emergency room at times, sure, little Johnny could have had trouble breathing. They could have given him an inhaler, but it doesn't really per se state that he truly has asthma. So, and then at that point, that's when the confusion begins, because the families are now thinking, oh, my child has asthma. I really don't know what to do with this inhaler. My doctor's not giving him another one. What do we do? So we do see that confusion a lot in the home when the family is given an inhaler per se at the emergency room versus the actual PCP. So we do work with that information, and we make sure to navigate them towards the appropriate location of going back to their PCP. So this is really where I want to spend some time. So in visiting our members, we've had a lot of barriers and, of course, our strategies that we use. And I'm going to give the floor to Vanessa to talk a little bit more about the barriers that we've seen in the home. But to go back, transportation has been one of the #1 barriers for us. And some of the things that we have done to overcome that barrier has been, transportation, really getting to know our resources out in the community and the county. Are there free bus passes that we can provide? Being a health plan, we do provide transportation to our members via Uber, Lyft, and or bus passes. So really getting to understand the community that you're working in, as well as understanding the health plans that you work with. What transportation services do they provide or that you can receive for your members and or community. So I'm going to let Vanessa share a little story with the transportation being a barrier.
Hi, good morning, everybody. My name is Vanessa. So I am one of the lucky community health workers to work under Carmen. And yes, so just like she was stating currently, these are some of the most frequent barriers that us as community health workers see within the home. So me actually being out in the trenches, being out in the homes, transportation was definitely a big one. And as she mentioned, the great thing about working here or our members having IEHP is that we are able to connect them back to our transportation department. So I actually do want to share a little story of a family that I visited. I believe it was the daughter who had asthma, and the mother was confused as far as her medication goes because she didn't know if she should be on the controller medication, the rescue inhaler, and so forth. So when we connected the member with the PCP, we were able to make a follow-up appointment for her. She unfortunately didn't have a ride to go to the PCP, but obviously she wanted to connect with them. She wanted to know exactly what she can do to have her daughter on a pathway to control her asthma. And so thanks to our transportation department, we were actually able to go ahead and schedule a pickup from a Lyft driver to take her to her doctor appointment and back to her home as well. So that was a big a barrier that this particular family was facing, that with being able to provide that solution to it, just cleared up the whole situation, because I do strongly believe that we have to keep in mind the approach that we do when we are visiting these families. We have to realize that a lot of the times the adherence to the medication is not intentional, although sometimes you will find those families that sometimes, because of lack of confusion with medication or what have you, they are intentionally not adhering to it, but a lot of the times it is unintentional. So by providing strategies to these barriers, we're able to assist these families with helping that adherence to the medication. So.
Thank you, Vanessa. Another barrier, of course, is language. We've come across, making sure that the community health workers in the home can meet the family. And when I say language, we also have to think about, we're working with families of a low-income population. We're working with families that some of them may not have graduated high school or have trouble reading or writing. So all of our material that we showcase our families, all the materials that we leave behind. So all of our asthma education is very visual. Some of the slides that Traci had showed you previously are actually some of the pictures that we showcase in the home. And we are, all of our language is at a 6th grade reading level. We don't go above that. We work with our marketing team just to ensure that the language is easy, clear, and in any language that we can provide, we do. And one of the other concepts here with our language is, of course, with our asthma education is the big words under asthma medication, all those fancy big words, they're not going to understand. So we've had to work with our health ed department as well as our pharmacy department and really strategizing how do we make this easy for them to understand so that when we are educating them, it's not going over their head, it's really being embedded. And thankfully, it's worked. It's worked so far. We've seen great success with this barrier in itself by being able to make sure we're meeting all of our families at the level that they need to be met. Another barrier that we've seen is no time. We've come across a lot of families. Again, we have parents who are working consistently. So as community health workers, it is our job, it is our due diligence to make sure we meet them at when we can. So we are ensuring to overcome that barrier is really making sure that we're meeting the families where they can. Sometimes we're working at a park, sitting with them at a park. We're in their home, aside from their homes. We're at their work during their lunchtime. It's really working around the family's schedule and making them still feel as comfortable as possible. By, of course, still adhering to personal health information and not making sure we're in an enclosed space. Another barrier is lack of understanding of the disease. A lot of our families don't understand what asthma is, and we've realized that. And that's one of the things that as we've worked with our families in their homes, in their own space, they're fundamentally confused. So one of the great innovative ideas that to overcome this barrier, because we are a non-clinical team, is we've been to partner up with a local pharmacy, and for us, we've been able to partner internally as well as externally with pharmacists to where we start FaceTiming. So we actually have the opportunity while we're in the home and we come across a family who's fundamentally confused on how to use the controller or the rescue inhaler or the spacer or any other medication, we on the spot are able to FaceTime with a local pharmacist, where then the pharmacist can come in and visually show them how to use the medication at hand. We are, as community health workers, we are able to showcase to the pharmacist, these are the medications that the family currently has. Can you please explain next steps? So that's been a great innovative strategy for us that has worked successfully, and I'll go ahead and let Vanessa showcase a story on that.
Yeah, that one was actually a big one as well. And going back to what Traci mentioned earlier, as far as the fear of the steroid, because that one was a big barrier with us. But again, it is lack of the understanding of the disease, lack of the understanding of the medication. So since Carmen mentioned we are non-clinical, we're not able to really go in depth as far as being pretty detailed with explaining what everything is. But using our technology, using the FaceTime with our pharmacy, I did have a member who was very fearful of giving the medication to her daughter because of the steroid that the albuterol had. And so once we actually called into the pharmacy, the pharmaceutical tech was able to provide that information, letting her know, hey, this isn't the typical steroid, like Traci mentioned, that fitness people use or that trainers use or what have you. This is the one that specifically only goes inside the lungs. It only goes inside the airway. That's the only area it's targeting, so that the parent isn't stressing about, what is exactly going to going inside my child's body. So having that backup with our health education department, and us being able to connect them to a class, because again, the type of education that we gave was very basic, but thankfully, since we do have our own community resource centers, local ones at that, we're able to connect them to go back to those centers where in turn they can have an in-depth class and learn a little bit more about asthma, learn a lot more about the medication that their child is taking. And those was another great resource that we were able to provide, because those classes are 3-4 hours, so they really do go in depth. They really do provide information to the parent so that they're a little bit more comfortable adhering to that medication and providing that medication to their children.
So I know we're a little short with time, so I really want to be able to open up for Q&A. and I know Arden or Ashley, the facilitator, can take that over, but just to end our portion is really just, we've come across a lot of barriers, but we've really had to be innovative on our approach. It's always conversational when we're in the home, and it's really just building that immediate rapport with our families in the home and thinking outside of the box. Very visual, making sure we're meeting them at their level of need, and ensuring that we're always connecting them back to their PCP, if not the health plan if needed. So with that being said, do you guys want to start Q&A at this point?
Yes, thank you, Traci, Carmen, and Vanessa for reviewing the types of medication and providing the skills. And thank you to everyone who attended. We have limited time for questions, which we apologize. We will have time to answer 1 or 2 questions, but the rest of the questions you can refer to the contact information slide. Okay. Yeah. And Ashley or Natalie, again, we're having trouble advancing the slide. So if you guys could do that for us, that would be great. Thank you. And we're going to go forward, a couple. Yes, and the rest of the slides will be provided in the link. And also you can visit it in YouTube. Ask questions. Okay, so one of our questions is, any suggestions for mouth rinse in children under 4 who may not be able to follow directions as well? So Carmen and Vanessa, do you guys have any suggestions for that?
Can you repeat the question? We missed the first part of it.
Yes. Any suggestions for mouth rinse in children under 4 who may not be able to follow directions as well?
I think the one suggestion, we've actually had we've had this case actually where we played a game. So we would have the 4-year-old join the education aspect. When we were providing the education with parent, we had the 4-year-old join us, and we simply made it into a game. So we showcased to the child at the time, this is what you do, and then you count to 10, and you go ahead and spit it out. And so just making it a game and making it fun for the 4-year-old worked. I couldn't tell you if the 4-year-old stuck with it because it's been a while since we've revisited that case, but at the time they were excited about it, so that would be my suggestion, is making it a fun game with the child so that they know they don't see it as this is part of my medication I have to take.
Okay, and Traci, do you have any suggestions?
No, I thought that was perfect.
Okay. So our other question is, I learned that using the asthma chamber and spacer works better in absorbing the medication. Does this have the same effect with adults? It was my understanding that only young children were the ones to use the chamber or spacer.
Yeah, this is Traci. I would like to answer that. No, as a matter of fact, it's encouraged through the National Asthma Guidelines that everyone that uses a meter dose inhaler, no matter what age, use a chamber, because you have to remember it's getting more of the medicine deeper into the lungs and less on the back of the throat and the tongue. So that's going to benefit anybody that's using the inhaler. Now, kids definitely need it, and older adults. You get to those in-between ages and they think that they can do it fine without it, but majority of people do not have proper technique. So it is actually, through the guidelines, again, it's important that everybody uses one.
Okay, great. So this is all the time we have. If you have any further questions, please refer to the slide with the contact information. And we just want to thank everyone for participating. And now we're going to switch it over to Ashley.
Hello, everyone. This is Ashley Kissinger from the California Department of Public Health. Thank you so much for joining our webinar today. Shortly after this webinar, we will make the recording available on our YouTube account. Everyone who joined today should also receive a certificate of participation, which we will email to you with the email that you logged on to the webinar. And if you have any questions, you can email Melissa or Arden with the contact information that's listed on the slide. Thank you so much, and we hope you all have a great day, a great afternoon, and we hope you all stay cool. Thank you.
Thank you.
Thank you.